Hey, good morning to you guys. As you can see, I'm sporting my red for some of the important women in my life and even some whose lives have been claimed by this disease. So this morning, we want to provide you with some tips for maintaining your heart health. And joining us now is WellStar cardiologist, Dr. Melissa Burroughs. Thank you, Dr. Burroughs, for being here.
Hi, good morning. Thank you for having me.
So let's get right into this. What factors increase your risk of heart disease?
Well, there are a number of risk factors for cardiovascular disease. Some of them are clinical risk factors such as obesity, high blood pressure, high cholesterol, diabetes. And then there's multiple lifestyle risk factors like tobacco smoking, poor exercise, poor diet, and decreased sleep.
You know what's something that always strikes me when we talk about a day like this one is that so many studies show African Americans are disproportionately affected by heart disease. Why is that the case?
Well, African Americans have a higher prevalence of many of the risk factors I mentioned, specifically obesity and hypertension. And hypertension increases the risk not only of heart attacks, but also heart failure and stroke. And so we oftentimes see African Americans with stroke, often at a younger age.
What are some of those signs or symptoms that people should be looking out for?
Well, what I always tell my patients is any change in your ability to do physical activity, any exertional symptoms could be a sign of heart disease. So oftentimes I talk about chest pain, chest discomfort, but sometimes it can be exertional abdominal pain, exertional jaw pain, exertional shoulder pain, and any kind of shortness of breath with physical activity or just inability to exercise the way you normally can be heart disease.
And I've got to know because when certain things happen, it's easy for us to talk them off and say, okay, maybe it's not that big of a deal. But when do people need to really be visiting their doctors or even going to the hospital if they feel something just isn't right?
Well, any kind of chest discomfort that lasts for more than a few seconds and is worse with physical activity, you should get medical attention, almost immediately, especially if it's getting worse and doesn't go away. Sometimes it can be heart disease or it can be other types of serious illnesses. Everyone should have regular checkups, especially to monitor their blood pressure.
All right, sounds good. Well, we thank you so much, Dr. Burroughs, for your time this morning. And always just a reminder just to keep yourself healthy, checking in with the doctors because that's what the experts say. Guys, back to you.
Yeah, and